Hello and welcome everyone. Thank you for joining this evening. I'll give everyone an opportunity to get settled in, get your screens looking nice, make sure your sound is okay, you can hear us properly before we get started. Make sure you have your snacks, your waters ready, because we have some great information to share with you on this evening. So it looks like the numbers have started to stabilize. So hello and welcome to our event this evening. My name is Lionel Edmonds. I'm the manager of admissions and enrollment for the University of Queensland, Ochsner Health. Today we'll be hearing from some panelists about the many scholarship opportunities provided by the University of Queensland, Ochsner Health. Just a few tidbits before we get started. If you do have any questions, you can go ahead and enter those into the chat room at any time. We will be monitoring those questions and hopefully we can get to answer all those questions. I'll go ahead and share my slides and introduce everyone to you for this evening. All right, this evening's webinar is titled Discover Our Scholarships. These are three presenters for tonight. We have Associate Professor Dr. Tamika Webb-Detiege. She's the Deputy Head of Admissions and Enrollment. We have Scott Peters, who's our Director of Medical Education. And we also have Monique Salazar, who's our fourth-year medical student and our recipient of the Perla S. Gill Scholarship. Just a quick map that we like to show everyone where we're located. And without further ado, I'll go ahead and pass it over to Dr. Webb, and we'll go ahead and jump on in and get started. You're muted, Dr. Webb. Yep.
Good evening, everyone. My name is Dr. Tamika Webb-Detiege. I'm a rheumatologist by trade, and I'm the Deputy Head of Admissions and Enrollment. Next slide. So one question you may ask is, who are we? So let's talk a little bit about our school. Next slide. So for those who don't know, we are a combined school with the University of Queensland and Ochsner Health. Our students spend 2 years doing all their basic sciences at the University of Queensland. You can see it on the map there. And the University of Queensland is a top 50 global university. So you have the opportunity to study at a world-class university. It has 6 faculties. And for us, that's like 6 schools. So they have the School of Engineering and Architecture, they have the School of Business, they have the School of Medicine, School of Science. They also have 30 plus teaching and research sites. And so you have a lot of exposure and opportunity during your training, and there are 8 research institutes. Not to be outdone, Ochsner Health is pretty big in terms of research as well. And we are a large institution. We're number 1 in Louisiana for our hospital. We have 40 total hospitals and 100 health centers. We have over 1,330 physicians, and 90 medical specialties are represented here. And so you will have a clinical experience that is excellent at Ochsner Health. Next slide, please.
Thank you, Dr. Webb. Now we're going to go ahead and pass it over to Scott Peters, who will talk about the Perla S. Gill and the Dr. and Mrs. Gregory Family Medicine Scholarship.
Thank you, Lionel. Good evening and good morning, wherever you are. My name is Scott Peters. I'm the Director of Medical Education at Ochsner Health and the Program Director for the Ochsner Clinical School. The Dr. Roy Gregory practiced primary care for 37 years in Mandeville, Louisiana, which is about 45 minutes outside of New Orleans. and he provided full service family medicine to meet the needs of his community. In the beginning, he was just a two-person practice and was the first on the North Shore to join Ochsner, eventually growing into a primary care practice of 14 physicians with 3 locations, including a super clinic in Covington. Dr. Gregory retired practice in 1997. This scholarship was established to support a senior medical student at the Ochsner Clinical School who has a commitment to pursue a career in family medicine, displays academic excellence, and is dedicated to upholding the high standards of the medical profession, and a genuine love for the communities they serve, as exemplified by Dr. Gregory throughout his remarkable career. Applicants must be enrolled in year 4 of the UQ-Ochsner program and be in good academic standing, which includes successfully passing step 1, maintain a GPA of 4.25 or above out of a scale of 7 points, have not failed or been required to repeat any rotations during their medical school enrollment. Consideration will be given to academic achievement during medical school, as well as an applicant's commitment to pursue a career in family medicine, as evidenced by volunteerism, research, or other activities relevant to the field of family medicine. Applicants must submit an application form and a 500-word essay describing their commitment to a career in family medicine. The application timeline for this scholarship is early in year 4. Applications are reviewed by the Dr. and Mrs. Roy Gregory Scholarship Selection Committee, which is composed of at least 3 family medicine faculty members at the Ochsner Clinical School and chaired by the General Practice Clerkship Director. The scholarship awards $1,500 to up to 2 students interested in pursuing a career in family medicine. Next slide. Dr. Perla S. Gill trained at Ochsner and Mount Zion Hospital in San Francisco before practicing anesthesiology for over 20 years at Sharp Memorial Hospital in San Diego, California. She was born in Santiago, Cuba, and grew up in Spain and Peru. Her father was an ophthalmologist, and she followed in his footsteps to a career in medicine. The goal of this scholarship is to enhance diversity at Ochsner in the medical profession by supporting female Ochsner Clinical School students of Hispanic descent who have traditionally been underrepresented in the medical profession. Applicants must be enrolled in years 3 and 4 of the UQ-Ochsner program and in good academic standing, which includes successfully passing step 1, maintaining a GPA of 5, and have not repeated or failed any rotations during medical school. Recipients must be a female of Hispanic descent, defined as either self, one or more parents or grandparents having been born in one or more of the following countries: Cuba, Spain, Mexico, Guatemala, Honduras, El Salvador, Costa Rica, Nicaragua, Panama, Colombia, Venezuela, Ecuador, Peru, Argentina, Chile, Bolivia, Uruguay, Paraguay, Puerto Rico, and the Dominican Republic. Applicants must submit an application form, a 500-word essay describing distance traveled, and provide proof of their Hispanic heritage. The application timeline for this scholarship is early in the academic year, around March. The applicant may apply in both year 3 and year 4. In other words, if the recipient receives the scholarship in year 3, she may also apply for it in year 4. A committee of faculty appointed by the head of the Ochsner Clinical School that includes a majority of women and Hispanic physicians will select the recipient based on academic merit, fluency in English and Spanish, and demonstration of distance traveled in terms of overcoming obstacles or hardships like socioeconomic or educational disadvantage. This scholarship is an annual award in the amount of $10,000. The number of awards is determined annually by the selection committee. Thank you, Lionel.
All right, thank you, Scott. Now we'll go on over to Dr. Webb again, and she'll present the Ochsner Physician Scholarship.
All right, next slide, please. So in Louisiana, We've been dealing with healthcare disparities, and what we've seen is that Louisiana ranks 49th or 50 in many of the health studies comparing other states. So the state of Louisiana made a decision to work towards developing a healthy state by the year 2030. And the goal is to increase our rankings to 40th by 30. So it's a 40 by 30 commitment. There are many people involved and groups involved in this process, and you can see them shown on the actual state there. But Ochsner is serving as the catalyst to drive this change and to make sure that we reach the goal of 40 by 30. So this is very important to Ochsner as an institution, and we have multiple targets that we're working towards reaching. On this slide, you can see focus areas listed, one of which is cancer and chronic conditions. We have higher numbers in the state of Louisiana of citizens with cancer and with chronic illnesses. So our goal is to increase screening, to improve access to treatment for chronic conditions as well as for cancers. Another issue that drives the health in Louisiana is smoking. And Ochsner as a whole has been committed from the very beginning with the research that Dr. Ochsner did on smoking and its impact on the lungs and health as a whole. But we also know that it drives the chronic illnesses and cancers in our society. So we're working towards getting comprehensive cessation services to our citizens, and as well as focusing on living in a tobacco-free environment for all of the parishes, which are our counties in Louisiana. Another way we want to target a healthy development of the state is improving workforce development and education. This will allow the population to expand its financial means and be able to provide themselves with healthy food, access to healthcare as well. So other areas besides just health itself is technology. So we know that information is power. Information allows patients to get the needed understanding of how to manage their health, to improve their health literacy, and to communicate with providers. And so the goal is to help improve the technology broadband infrastructure that's available to the citizens. And then also, we want to be able to collect the data that shows us what's going on in the state with insurance companies and what the state actually needs in different areas. So those are our focus areas that we're working towards. So why am I mentioning that to you? In an effort to improve the health of the state, we know that we need more physicians to learn in Louisiana and actually stay and practice in Louisiana. So Ochsner developed the Ochsner Physician Scholars Program. It was launched in May of 2021, and its goal is to increase the number of primary care providers in the state. And so it includes psychiatry, but the main focus areas are family medicine, internal medicine with a primary care focus, internal medicine, and pediatric dual certification. So those are the areas along with psychiatry that you can study in and receive this scholarship. We want someone who's going to be committed to being employed at Ochsner Health, which includes Ochsner LSU Health in North Louisiana, for 5 years after their residency. So to be clear, you don't have to do your residency at Ochsner, but you're committed to work in an Ochsner facility for 5 years after residency. Next slide. So there are a couple of tracks, and the one that applies to you is the UQ-Ochsner Health track. And this track involves students in their 3rd and 4th year of medical school. They must be in good standing. They must have successfully completed step 1 and step 2 CK on their first attempt. So how much money do you get with this? Well, it is a pretty substantial award. So if you apply and receive the scholarship in your 4th year, you will receive one full payment of $135,000. If you apply in your 3rd year, you will receive 2 payments, $67,500 in your third year, and the same amount in your fourth year as well. So for 2023, we will award up to 5 scholarships. Next slide. This is the timeline that we're using in 2023. So the application is available on our website, and the deadline was March 1st, 2023. The applicants will be notified, and then they'll receive interviews, those who are the finalists, and the determinations on who will receive it will be at the end of this month. And the funds will be distributed shortly after. So there will be taxes withheld, but it is still a substantial amount to put a dent in your costs for medical education. Next slide. So what are the academic entry requirements into our school to even get to the scholarship? We have a requirement for the MCAT of a 504 as the minimum. The GPA you must have is a minimum of a B average, and that can be in your bachelor or your master's degree. Basically, it's the most recent obtained degree. And we have 2 prerequisites. So unlike traditional US medical schools who have biology, chemistry, organic chemistry, and physics and math, all those other great stuff that you have to do, we have just these 2 prerequisites, which are second level integrative cell and tissue biology and systems physiology. But the great thing about UQ-Ochsner is that we also have equivalent courses that you can take for free if your training so far has not covered those prerequisites, and you'll get more information about that when you apply. Next slide. So after you fulfill those 3 requirements, then you will be invited to the multiple mini interview. And the basic reason we do the interviews is that we want to be able to assess the personal qualities of our students, because you will be dealing with patients and patients from all walks of life. So we want to know what your qualities are, and those things like kindness and compassion are important, integrity, adaptability, verbal communication. So medicine is not just about what you score on a test. It's all about how you interact with patients and colleagues as well. There are 8 successive 10-minute interviews, and currently, because of COVID, we conduct our interviews via Zoom. So our application process is very simple. You apply online, it is free, and our applications open in November. We have a rolling admissions process. It is important for you to apply early before spots are filled. We interview starting in March. We have interviews coming up again in June. So if you're interested, definitely get in your information. And the interviews will continue until we fill our class, which usually is in early fall. So it's important for you to get things in as soon as possible. We make offers on a rolling basis, and they're made through April to November, depending on how far out we go.
All right, thank you for that, Dr. Webb. We really appreciate it. Now we'll pass it over to Monique, who's our 4th-year medical student, so we can learn a little bit about her and her journey to UQ-Ochsner.
Hi, everyone. I'm Monique. Good morning on our end. I'm actually located in Brisbane at the moment on a 4th-year rotation in hematology oncology. I first found out about this program actually by my dad, who read an article about it in the Wall Street Journal and said, oh, you should apply. It looks like a really cool program. You got to go abroad, which is something that you've wanted to do. So be in a prestigious program and come back to the US and practice. And so at the beginning of January of 2020, I moved to Australia to start my first year. Our first year was a little bit more complicated, given that we were abroad and overseas, and COVID started. So I spent the entirety of my first 2 years here in Australia. The one great thing that I do have to say about my time here was due to our COVID regulations and how well we did during that time, we were actually able to go into the hospital in our first and second years and be a part of the team and still do our shadowing and our work. We were really not hampered by the COVID outbreak in regards to that. And so our third and fourth years are back in the United States. During our fourth year, we have to come back over here for 6 weeks to do one of our rotations. I happen to do hematology oncology, but my roommates are doing ED and orthopedics while they're here, located at different hospitals, all within Brisbane. It's also my understanding that you can apply to go rural if that's something that you decide and it's available to you. And in my third year, I applied to the Perla Eskil Scholarship. All my family is Hispanic. Both of my parents were born outside of the United States. And I thought it was a great opportunity for me to not only connect with my Latin roots. I work at Luke's House, which is a Spanish clinic in New Orleans. And we do translations for doctors that provide free healthcare to the Hispanic population there. And am reapplying again this year, given that you are allowed to apply in your third and fourth year. Application was pretty easy. They actually reminded us to apply multiple times in emails during my third and fourth year, and was very lucky to be able to win in my third year, and we're still waiting to hear back about my fourth year. It actually has opened a lot of possibilities for us. I was able to start the Latin Medical Student Association at Ochsner as a result of doing it, and went to their annual chapter conference and was able to present a poster in my fourth year at the beginning of my fourth year. So yeah, that's just a little bit about me.
And what undergrad? Where'd you go for undergrad, Monique?
I went to Emory University in Atlanta, Georgia for my undergraduate, and I graduated with a degree in human health.
Thank you for that. All right, all of our presenters have presented the information to you. Now we open the chat room up for questions. If you do have any questions, please enter that into the chat room. Sue, if you could let us know if you have any questions. In the meantime, Monique, question for you. What is the greatest thing you liked about being a UQ-Ochsner student?
Honestly, the community that was built, I have to say, was absolutely incredible. I have friends for life. I have absolutely incredible faculty mentors throughout this whole process. I am interested in going into pediatrics and have been able to connect to a lot of the pediatric doctors who have recommended to apply for scholarships, to apply for grants, and have really led me in my process and eventually applying for that residency.
All right. We'll go to Dr. Webb next. What kind of student do you see being successful at UQ-Ochsner?
So the kind of students that are successful at UQ-Ochsner are those that have a sense of adventure, because it is a big deal to go to another continent to learn. So we also need people who are not afraid of change. They have the ability to pivot when things change. And that is basically what medicine is. So you can't be someone who's stuck in, doing it the same way all the time. When you go to UQ, you learn about medicine delivered in their system. And then you come to Ochsner, you learn how we deliver medicine. And what our students bring back is a perspective for us to think about things a different way. So you want to be someone who's interested in learning about other cultures, that being the culture in Brisbane and that being the culture in New Orleans, both very different, unique places to learn.
All right, thank you for that. Looks like we have a question. Sue, do you want to filter that one out?
Okay, here we go. Yeah, from Lydia. Thank you, Lydia. I know some of these scholarships are newer, but how competitive are these scholarships? How many students take advantage of them over the past few years? So, Dr. Webb, do you know about our competitiveness for the scholarships?
So they're very competitive. We have a number of students who are excelling. And so all of them are eligible for the Ochsner Scholarship Program. And then the other scholarships are based on the number who are interested in family medicine and who fall in the category of being Hispanic. So it just depends on the number of people who fall into those categories, but they are still very competitive. And just because you're the only one, you still have to have an application that is substantial. So it is a competitive, highly regarded process.
Thank you, Dr. Webb. We also have a question about what is our match rate for our students?
So our match rate is excellent. Our match rate this year is 96%, 98% last year. We match at or above the rate of US medical schools. And we definitely match beyond the rate of international medical schools, as well as those DO schools. International medical schools, graduates tend to have a 50 to 60% match rate, where we're at the 96, 98 match rate, and DOs tend to have about an 80 to 85% match rate. So we're a hybrid that performs at or above that of US medical schools. So you will have the best chance to match at our institution.
And then a question about, is our program available to Canadians as well, or is it just US citizens, permanent residents?
You must be a US citizen or permanent resident.
Thank you. And do most students stay in Louisiana, or do they enter Australia for residency?
So you have the qualifications to practice in Australia, but what you must understand is if you do a residency in Australia, you can't practice in the United States. You must have a United States residency in order to practice here. So we do have some students, and I think our head of school tends to say, for love of country or love of somebody in the country, decide to stay in Australia. And maybe it's about a little under 10% a year will decide to stay, but that's very risky. And so I always recommend that you do your residency in the United States, and you can always go back to Australia and practice, but you can't do it vice versa.
The chat room, anything else? Let us know. Great. Okay, for the MCAT, when do you submit your score? So you can
submit it on a rolling basis. You submit them when you apply, because you want to get your application in as early as possible before all the spots fill up. I believe there was a question about MD, PhD.
Oh, great. Yes, sorry.
We do have an MD, PhD track. It also is very competitive. You must have successfully completed your coursework early on to be considered. So you can't just come in and say you want to be in that track. You have to apply. And we do have students who successfully do the MD, PhD track.
And what about family friendly? How is our program in regard to being family friendly? Are most students married?
So we tend to have an older student population. Many have had careers outside of medicine. So they may have been professional people, teachers, lawyers, other careers, and some have families. We have had students who bring their family over. It's a big commitment for a whole family to move, but it does happen and it's possible.
Okay, and I know we have preparations in place for step one. Scott, would you want to talk about our preparation for step one?
Sure. We provide our students with 2-year access to boards and beyond. We also provide them with the first aid book for studying for step one. And they also receive a full year subscription to the Step 1 UWorld QBank in second year. Additionally, we have a specific course that prepares our students for taking Step 1.
Thank you, Scott. That's really effective in helping students to pass their step one as well, having that course. Okay, we have a question about specialty of plastic surgery. And do we provide resources to prepare students to match into plastics?
So definitely, it's important for you when you start medical school to decide what kind of track you want to go to. We have society heads. Each student is placed in a society, and that society head will help you find a mentor if they're not in your specialty, and they will help guide you toward developing the proper application you'll need to match in plastics. So we have students who match in very highly competitive specialties. So you just have to be aggressive about what you want and make sure that you meet those qualifications, but we have access for you.
Thank you. And Stephanie wants to talk about a little bit about the early patient interaction during the first 2 years.
Monique, you want to share your early experience?
Yeah, we are very much thrown into the hospital pretty much from day one. During the end of our first year, we spend 4 weeks doing an observership in a specialty. And at that point, you're pretty much, in the hospital with doctors, going into patients' rooms, practicing your exams. And then throughout your second year, one of your classes is indeed being in the hospital, and shadowing a physician and pretty much living their life.
So I'm gonna give Monique another word. We don't throw you anywhere.
Sorry.
You in the hospital so you can experience it. And we know that our students, that early experience allows them to arrive in New Orleans ready to move through the clinics in the hospital. We have experience with students from other universities, LSU and Tulane, and our students are heads above in terms of being able to interview patients and do their physical exam. So that lightly placement in the hospital early on helps them to be successful in their clinical years.
I'll very much comment to that because we're placed with Tulane and LSU students at Ochsner, especially in specific specialties, and you could tell the difference for those of us that were exposed very early on, to be allowed to be in the hospital instead of just being our first 2 years being our book years, essentially, our study years for step one. It really did make a difference when we were first interacting with patients and first really seeing a clinical picture that we had to decipher.
Thank you. Dr. Webb, there's a specific question about the delineation of the specialties that the physician scholars is for. In particular, would peds, IM peds, would that be considered for this scholarship?
Yes, but it has to be primary care, IMPs.
Thank you.
And they
Okay.
will review your application to make sure that that still applies. So you want to make sure that you clearly designate what it is before you expect to receive that funding.
Thank you. And for MCAT scores, yes, continue to submit even after June, because we will continue to interview until we fill the class. It's just always better to have your application and your score in as early as possible. Okay. How large are our classes and are lectures recorded? Maybe
Yeah,
Monique?
so lectures in Australia, they are recorded. All of them are placed online within 24 hours of it being done live. You are able to go to them. It depends really, the class that you're in will determine your class lecture size. In Australia, your cohort is much bigger than it is at UQ-Ochsner. So sometimes they are in big auditoriums, but the professors are very much willing to answer any of your questions that you have during lecture. And then once you get to Ochsner, they're a lot smaller, especially when you start doing your clinical placements. Those will be in person. More and more, we're trying to do them in person and less doing them over Zoom. And those will be maybe 5 or 6 people. Sometimes it really depends on how many people are in that clerkship at the time.
So UQ-Ochsner is a component of the University of Queensland Medical School. And so our class size each year is 90 to 100. But when you're in Australia, you're with all of the students, and that is about 450, 500. And so you're not, you're a part of the school there. And then when you come to New Orleans, you are the school.
Thank you. Now, as we know, Monique is right now on a rotation in Australia, but what other countries can students rotate? Dr. Webb, do you have that information?
So with COVID, some of the restrictions have limited things we used to do a great deal of. We had a Haiti rotation. There's a rotation to India. There's a new one to South America that the pediatric
Panama, we're going to Panama at the end of the year.
Panama, there we go. And so there are more opportunities and there are options for you to select, but they'll have to be approved. But understand that with COVID, there are different regulations, and you always have to make sure the places you want to go are vetted and that it is approved before you make any moves. And they'll help you here to find opportunities. The India one is Manipal, and then there was another one, but I'm not sure. There's always some evolution.
Now, Dr. Webb, earlier you said it's
Just
sorry.
piggybacking on that, I do know Colombia was in the pipeline. I'm not sure if we made it that far because of COVID, but like Dr. Webb says, there is evolutions every year.
Thank you, Lionel. So Dr. Webb, earlier you said you always recommend finishing a residency in the US, but does that have anything to do with, is it difficult for an American to be a physician in Australia?
No, it's not that it's difficult. It's that if you decide you want to come home and practice, you know, we have people who have family issues that happen and now they want to come back. So, well, they now have to do a residency in the United States. But if they had trained here and then went to Australia and then wanted to come back, they wouldn't have to re-enter training again. And so you could go through all of your training in Australia and then have to come here and repeat training. So you don't want to do that. I wouldn't want to do that personally.
Thank you.
I'll speak for myself. Resident twice, no.
Okay, comparing first 2 years in Australia to the first 2 years in the US, do you think they're equal in workload, or is one more difficult than the other? What do you think, Dr. Webb?
Only
You think?
Monique? That is Monique.
I'd say very much equally as rigorous, if not more. You are expected to sit the USMLE at the end of your second year, which, as everybody knows, is very difficult as it is. But on top of, you know, your US studying, you also have your Australia studying. It covers the same content, but there are sometimes like Australia specific questions that you do get on your exam, but they're very easy to cover. So I'd say equally as rigorous, if not a little bit more. I think the early exposure that you do have in hospital really does make a big difference in your first 2 years in studying. It kind of pieces together what you're learning and what you're seeing in real life.
And
Yeah,
Dr. Webb, maybe you can answer a little bit further, but I think the question was geared to comparing our first 2 years to US medical school's first 2 years.
Mhm.
So you receive all of the training you would receive in the US, the same types, subject matter and topics, so that you'll be successful in the step. So you are equally in difficult situations either way. It's medical school.
All right, questions are starting to flow. Please, if you have any questions, go ahead and enter them in the chat room.
Okay, here's a question about the last 2 years that focus on rotations. The last 2 years in Louisiana are focused on rotations. Right, your rotations, Monique, you could probably answer that. When you're in Louisiana, what are your rotations like?
So our rotations are the same basic rotations that you have to take for any other US medical school. And those are the ones also that prepare you for your step 2 exam. So your core curriculum include internal medicine, surgery, pediatric psychiatry, and OB-GYN. And those are all done in your third year. And then your fourth year, you're allowed elective time. So time in which the specialty you choose to pursue, as well as other rotations like ICU, emergency, orthopedics, and stuff like that.
And let's talk about housing for fourth year's 6 weeks rotation. When you go back to Australia, how are you managing that? Do you find temporary housing since students are coming back from the US after being there for about 2 years?
I could probably answer that. So I currently am in an Airbnb with other fourth year medical students, and we're all splitting that. I also have friends that are taking over. Some Australian students went to Ochsner, and so they did kind of a housing swap. And so you're able to find rooms if that's what you decide with other UQ students. And they have a student marketplace that's very easy to find housing, or some of us do choose to go and do like an Airbnb style for 6 weeks.
Okay. And Monique, since you studied for USMLE, was that the only exam that you had that prep for, or are there any Australian exams that you must take?
You have final exams like you do in any other school. So we had to prep for our end of semester final exams, as well as prepping for the USMLE.
And Monique, how hard was it to transition from the US to Australia?
It's kind of hard to answer that question because I got here at the beginning of January of 2020 and then COVID hit. So it was a very big transition, but it was a big transition for everybody across the world. I think that actually it was pretty easy to say, like the language is the same, the lifestyle is very easy. It is much more outdoorsy than what I was used to. But other than that, like the lifestyle was very similar. So I don't find that transition to be that big, other than the fact that mine happened during COVID and we were in lockdown for a long time. But other than that was I would say pretty easy.
Thank you, Monique. And how do you study personally? Do you use flashcards? Do you take notes? Do you like group study?
The answer is all of the above. During my first 2 years, I used a lot of flashcards. Most people will use Anki. That's kind of the way I would say most students, even in the US, use the same program. I use Boards and Beyond and use that heavily to study for the USMLE Step 1. Definitely taking notes, watching lectures online. I think it was just a little bit of mix of everything. I found during medical school that I studied best by using questions, getting them wrong, and then reviewing the information. I didn't necessarily love the flashcards. I still did them to remember the small details that were needed, but I actually found that using questions was better for me personally, but I can't say that for everybody.
Okay, and then you mentioned a few ways to find housing, like the marketplace and online. How did you find housing when you arrived in Australia for your first 2 years?
So I came about a week and a half before school started and kind of had been perusing online for apartments, and I had messaged somebody in our class about being roommates. And so both of us kind of did a divide and conquer type of scenario, and we were able to move in within 24, 48 hours of signing the lease. And so we were all up and ready to go by the time orientation came. But we pretty much came about a week before to 2 weeks before and found housing that way.
Thank you, that's helpful.
Monique, I have a question for you. If we have a prospective student that's straddling the fence on choosing UQ-Ochsner or another USMD school, what piece of advice would you give them to sway them to UQ-Ochsner?
I have really enjoyed my experience. I think that something important to me was being able to live abroad at some point in my life. It's going to get harder and harder as you pursue your medical education, as you go through residency and you become an attending or do a fellowship. I think this is a great time to do it. I think this is a great school. You know, we have a great match rate, which is really, really important to me. I want to be able to not only finish my medical education, but continue my medical education once I'm done. And so I found that to be a really important aspect in choosing. And that I also looked at the specialties that we matched into to see that that's something that I wanted to do. I actually thought about doing sports medicine and PM&R when I first came to medical school, and then I did my pediatric rotation and fell in love and switched courses. And so I think having an idea and seeing that there were people that matched into really good pediatric programs was very important to me.
Thank you. Now, during the first 2 years when you're in Australia, can you talk about any clubs? I know we have our student organizations. Are there any community service initiatives?
There definitely are. You can get very involved as soon as you get here. You know, the UQ class is very large and there are a lot of things that go on throughout the year. It's about 400 to 500 people. You do find that the Ochsner community is small and we're very close knit, I would say, while we're over here. And so we were able to, you know, be in contact with the third and fourth years that were over, like back in the US. But you're very easily able to get involved with not only community service, but doing research here as well.
All righty. Sue, you may know the answer to that question.
Yeah, so average age of students, actually, we have a broad range of students, of the range definitely, but the average age is about 25. So, but the range goes from, I checked last year's class, the youngest was 20, and we did have some older students that were in our class, several in 30s and some in 40s. So there is a wide range.
All right, it looks like our questions have flowed again and maybe have come to the end. So we'll finish off. Dr. Webb and Scott, if you want to leave one piece of advice, whatever it may be, and we'll finish off with that.
So my advice for you is that medical school is hard wherever you go. So you want to make a decision about what you want your career to look like. What do you want in your life? If you're interested in a university that has a global perspective, that's going to allow you to successfully match, that's going to expose you to all types of people and has a commitment to the community in Brisbane and also in Louisiana, then our school is for you. But sit down and think about who you are as a person and your ability to handle the transition to Australia, to the United States, back and forth. But I think that this is a top opportunity for anyone interested in medical school, and you can be successful here.
Thank you. And Scott?
I would say that we definitely have our proven track record that this program is successful. And just like Dr. Webb said, if you are an adventurous person and wanting to experience the beauty of Australia, this is the program for you. If you're scared to be away from your mom and dad, maybe you should think about somewhere else, because unless you're bringing mom and dad with you, they can always come to visit.
All right, thank you, Scott, for that. Looks like we've come to the end of our event for today. I'd like to thank all our panelists for your presentations this evening. I'd like to thank all of our guests for joining us. Thank our UQ counterparts for our support, and thanks Sue for our chat support. I'd like to say good day, good evening, or good night to you, wherever you are in the world. Thank you, and we see you next time.